joint reduction is down in 1950s, and stroke is also largely reduced in 1960s. That's a continued increase of life expectancy 2 and 3 years respectively. So we have some selected laws for healthcare system in Japan, and successful control for stroke and probably achieved by, as I said, insurance coverage in 1961, and also industrial safety and health. This is defined worksite health, and 1982 is health service. So the LD Act, it's a LD Act. It means from middle-aged man with the office government responsible to conduct a screening for blood pressure and dyslipidemia and so on. So community health. But we have another problem for aging. So emerging problem aging forced to form by government, and there was several medical care act, and long-term care insurance because of elderly is increasing. And on the other hand, we also focus on the Health Promotion Act for environmental tobacco smoking control. And in recent years, we also established Act of Prevention and Medical Care. It's called Health Insurance Act. It means every health insurer responsible to conduct screening and for lifestyle-related disease, specifically focusing on metabolic syndrome. And let me explain why Japanese is so high stroke in the past and low in skin disease. This is primarily contributed by diet. And so Japanese traditional diet is, as you know, high salt intake, low dairy product, low meat and low saturated fat, and high fish. These characteristics contribute to high stroke and low skin disease. But modern Japanese diet, we reduce the salt intake and moderately increase the dietary product. Still, we maintain high fish intake. So that's contribute to reduce stroke and keep skin disease low. And I'll go into the detail in tomorrow's lecture, but we have two types of atherosclerosis, arteriosclerosis. But in the arteriosclerosis on the right-hand side is a small artery pathology. This is dominantly influenced by hypertension. This is more common in Japanese, but atherosclerosis, lipid factor is more dominantly influence atherosclerosis, more common in Western countries. So, approach for risk factor control of prediction. We have a good system for risk factor screening, blood pressure, lipid and glucose, and also recently metabolic syndrome. Prevention is conducted by health professionals, also education, general population. The personal medicine, we are making many medical associations establishing guidelines, but also local physicians have some room to make a decision to treat for individual patients. And stroke is going down rapidly, as I said. This is stroke mortality national level, but in 90s there's a decline in stroke mortality is a little bit lower, but still continue to decline. And this is a coronary heart disease mortality. As you in the middle graph, it is confined to Tokyo and Osaka, two metropolitan cities. And you look at the bottom of the middle graph. This is a 30 to 49 young men. Is a decline with skin disease not so evident right now. Now suggest atherosclerotic phenomenon is appearing in the middle-aged or young adult men in the urban areas. So challenge for BBM in Japan is because we have rapid aging, so maybe a threat for increased CHD in urban area. And we also have celiac dementia, pneumonia, and chronic kidney failure and COPD is among one first 10 cause of death. So we have slow economic growth and suicide is another emerging problem in Japan. So emphasis on Japan traditional mind. Maybe we need to, because we are traditionally intelligence of patient and some cooperating yes, to seek a more sustainable healthcare system in the future. Lastly, an unexpected challenge for PPPM, as you know, is March 11, we had a large disaster, tsunami, and also nuclear plant disaster. This is, it's 15,000 people died, 7,000 people missing. So some of the disaster in medicine is one challenge, and this is also, it's very tough for prediction and prevention, but we can avoid some of the disaster from human being, and also personal medicine can be conducted. So this is one of the challenges to not only challenge in Japan, but also other countries in the world. Thank you very much.
I would like to attract your attention that Professor Izo put together the excellent issue dedicated to cardiovascular disorders. Please take a look, it is online. What I would like to add to this, can you imagine that despite of this disaster, the team was working in Japan to put together this issue, and we had no 1 day of delay for get groups, for delivery of the papers. I think that we should award it with a great applause. Thank you so much.
At the day of the disaster, I got an email from Olga. She willing to provide. She will inform to other members of EPMA, and she said we are ready to provide at least 30 families of evacuation from Japan. So. Actually, unfortunately, I didn't have to do that. But